Order, order. Thank you very much, all of you, for attending. Could we start with very brief introductions? Can I also apologise for the late start? Some private business that took us over our time, but start with you, Rob.
Thank you. Yes, I'm Rob Morrison. I'm the e-cigarettes policy specialist at the Advertising Standards Authority.
I'm John Newton. I'm the Director of Health Improvement at Public Health England and responsible for tobacco control.
I'm Ian Hudson. I'm Chief Executive of the Mhra.
And I'm Gillian Leng. I'm the Deputy Chief Executive at NICE, the National Institute for Health and Care Excellence.
Thank you. So could you all start by setting out where your organisation is at with regard to its view of e-cigarettes? With regard to the ASA and MHRA, briefly describe the sort of regulatory approach that you take. But if each of you could go in turn, can I just urge you, because we've got quite a lot to get through as a panel of four, keep your answers succinct, and on any individual question, if don't feel you all have to answer every question, but start with you, Rob.
Yes, of course. So our general policy outlook is that where products are legal and available to be sold, they should be capable of being responsibly advertised. Our major strands of work on e-cigarettes have involved, in 2014, the implementation of sector-specific rules controlling the content, placement and scheduling of e-cigarette ads. In 2016, we mirrored and then since then have been enforcing the wide-ranging advertising prohibitions that have come from the Tobacco Products Directive, which you'll be familiar with. And our most recent strand of work was was a consultation late last year to revisit the prohibition on health claims, which we implemented in 2014. And I can come back to that.
Yeah, we will return to that. Thank you very much. John Newton?
Well, firstly, it might be worth pointing out that the UK has an excellent track record on tobacco control in general, and we're delighted to see in the last 5 years reduction in smoking rates of a quarter. So we have a very good track record and internationally judged to have excellent tobacco control.
We're down to 16% now.
Yes, 15.5, yeah, 16 or so.
Is that one of the lowest in Europe?
It's one of the lowest in Europe. Sweden is still lower, but they use snus. But Sweden is slightly, and Sweden is of course a much smaller country. So we're very pleased with that progress. In relation to e-cigarettes, the approach across the UK has been to maximise the potential for e-cigarettes to drive down smoking prevalence, but at the same time to manage any risks with appropriate regulations. And as you will hear, and I'm sure you already know, the regulation in the UK is amongst the strictest in the world, apart from those countries that ban e-cigarettes outright. So we're pleased to see that we have minimum standards on safety for the devices. We have strict control of advertising. We have controls of packaging and of the packaging and description of the e-cigarettes themselves, and a minimum age of purchase was important. Public Health England has a number of roles. We continue to review the evidence and publish information for professionals and the public about e-cigarettes. We include messages about e-cigarettes in our public-facing campaigns, particularly Stoptober 2017, which was an important event. And we produce guidance for health professionals particularly, and also for employers in relation to e-cigarettes. We're concerned at the moment about the misperceptions about relative harm amongst the public, and we're also somewhat concerned that the uptake of e-cigarettes seems to have plateaued amongst smokers. But we're very pleased to see a general consensus around the view that e-cigarettes, use of e-cigarettes is likely to be substantially less harmful than
And you've
smoking.
come up with a figure of 95% less harmful. Is that just a sort of broad brush expression of them being vastly safer, or is the science behind the 95% figure?
Well, we quoted the figure. The figure, in fact, originates from a review of the evidence by independent scientists, and they themselves are quoting another figure. I mean, our position on that figure is it's the best available published estimate. It does have value. We are trying to convey the extent to which e-cigarettes are likely to be much less harmful than smoking cigarettes. So it's a useful figure, but it's not a scientific, it's not a precise scientific estimate. It's the sort of issue, as your committee will know very well, it's not the sort of issue that you can put a single number on. But we're trying to convey the extent to which e-cigarettes are likely to be much less harmful than smoking cigarettes.
Thank you very much. Dr. Hudson?
We regulate e-cigarettes under the Tobacco Products Directive, so we run the notification scheme for e-cigarettes. So companies enter their details in the European portal in terms of the nature of the product, the ingredients, the toxicology, the emissions, and then we download that data, we publish that data, so it's a notification scheme, and then after that we run a vigilance scheme, so any safety issues that occur with products can be reported to us via the yellow card scheme, and we may receive intelligence from elsewhere, and then working with trading standards and our partners, we can take action to address any safety issues that emerge during the course of use. There are limitations of the scheme in relation to tank sizes, 2 mils, refills up to 10 mils, maximum concentration 20 milligrams per mil, but we run this notification scheme. The alternate route for products, theoretically, at least to get to the market, would be via the medicines licensing regime, but that has not proven particularly popular. We may get into that a little bit more during the discussions.
When you say not particularly popular, there's not a single...
Nothing is marketed.
Yeah.
That's correct, yes.
And we'll come back
Sure.
to that. Professor Leng?
Thank you. NICE's role is to issue guidance based on the evidence produced by an independent committee, and it's aimed at professionals and commissioners. It's not aimed directly at the public, although we know that the public has an interest in what we produce, and indeed so does the media sometimes, so stories get out in that way, but it's primarily evidence-based guidance for professional groups. Our most recent piece of relevant guidance was published in March this year on smoking cessation, interventions and services, so a particular context around stopping people from smoking. It's not an overarching statement on e-cigarettes, it was in that context. And we were clear in that guidance about providing advice to people who smoke and are interested in using an e-cigarette. And we said a number of things, explained that they're not licensed medicines, but they are regulated. We said we advised that many people have found them helpful to quit smoking. We advised that people should stop smoking tobacco completely, and that the evidence suggests that e-cigarettes are substantially less harmful to health than smoking but are not risk-free, and that the evidence is still developing, including the evidence on long-term health impact. So we set out all of those things for professionals so they could have that informed conversation with smokers. We have got a suite of guidance on smoking that we are currently beginning to update, and a particularly important piece will be around harm reduction and smoking prevention in children and stopping smoking in pregnancy. But that's underway. We're currently scoping that, and it will be published in early 2020.
Thank you very much. Professor Newton, you gave evidence to the Australian Health, Sport and Aged Care Committee. And you said that the current evidence, and I quote, points us towards cautious use of e-cigarettes, close quote, rather than the perhaps more precautionary approach used by the Australians. So totally different approach that they take there. What do you think is the reason for the different approaches in the UK and compared to Australia and also indeed the United States?
Well, it is an interesting question why different countries have looked at the same evidence and come to slightly different conclusions about regulation. I think the Australian situation was different. They had lower smoking rates to begin with when e-cigarettes first appeared, and I think the feeling there was that they could continue to control and drive down smoking prevalence without using e-cigarettes, and therefore, in the absence of clear evidence of safety, it was wise to ban them. The situation has changed, and in fact, I believe that the outcome of that Australian review was a mixed outcome, with some members of the committee.
I think the chair just disagreed with the rest.
The chair disagreed, indeed, yes. So it would be interesting to be in a fly on the wall with the discussions. I think we might right there.
Something I might experience from time to time.
Yes. So I think one could ask the question, if the Australians were to be making the decision de novo now, would they have come to the same conclusion? What we do know is that in Australia the smoking prevalence has plateaued and hasn't continued to decline in the way that it has in the UK and the US.
So you feel very confident that we're in the right position based on the evidence?
I do feel confident. I think the scale of the harm from tobacco is so great, with 79,000 premature deaths a year caused by smoking, that if there is a good chance that more smokers will quit if they are encouraged to use an e-cigarette than would otherwise quit, then in fact the precautionary principle suggests that one should remove barriers to smokers using e-cigarettes to quit, and that's likely to save more lives than banning them completely.
Perhaps this is for John and Gillian. With regard to the assertion that getting people onto e-cigarettes maintains an addiction to nicotine, how significant, if at all, is that a concern to you, and what are the potential health risks associated with that? Gillian?
I think that's the distinction between using e-cigarettes as a quitting aid, which you clearly can do. You can downgrade the amount of nicotine that you get through the product, and it can help you to stop your nicotine addiction. The question is whether it becomes a long-term lifestyle choice, and I think there might be questions about that because of the way e-cigarettes are being marketed. They are being marketed as an interesting, exciting, edgy product that might encourage people to use them in the longer term.
But is there a problem with it being a long-term lifestyle choice? I mean, if it doesn't have any health consequences, then that's for the individual, isn't it?
That's for the individual, but and we know that they are substantially safer than cigarettes, so that's good.
So what is the risk about continuing to be addicted to nicotine?
The risk is that we don't know what the long-term impact of using e-cigarettes is because they are new products, and we really do need to gather that information. Okay. They're 95% safer than cigarettes, but there's 5% that we don't know about.
John?
Well, I mean, there are some reassuring data on patterns of use. So we know that of the 2.9 million e-cigarette users, just over half have stopped smoking completely and are now using e-cigarettes. But we also know that there are approximately 700,000 people who have been smokers, have used e-cigarettes, and have stopped using e-cigarettes as well. So the large-scale surveys suggest that there's a progression from being a smoker to using e-cigarettes to stopping. And there is some evidence that the nicotine as delivered in an e-cigarette is less addictive than nicotine delivered through.
And is there any health risk associated with that continuing addiction?
Well, I think we don't know because no one has used e-cigarettes in this form for that long. But the scientific evidence suggests that the risk would be low, and certainly much lower than smoking cigarettes.
Liz?
It's easier to get hold of nicotine gum, and nobody's going around saying there is a long-term potential risk of carrying on using a nicotine gum. So what is the difference that you're worried about in e-cigarettes as opposed to gum? Or is there no difference? In which case, why is that constantly prescribed and you can buy it in a chemist whenever you want and nobody ever warns you about that? Is there any difference between the gum and the e-cigarettes?
Well, trying to make a comment that the gums have been licensed under the medicines route with a full package of data. I think the questions that remain outstanding for me would be some of the longer-term effects on the lungs in terms of the flavourings, for example, the inhalational route.
So in other words, nothing to do with the nicotine addiction, but
it's not
other
so much,
potential.
it's the other elements that may be in there, and the route of administration, the inhalational route, I think.
So it's not about the nicotine per se, it's about the mix of stuff in the e-cigarettes and the breathing in?
Yes.
Okay, thanks.
Thank you. Gillian, do you want to...
I was just going to say that there has been some concern expressed about the long-term use of nicotine gum, and there hasn't been any clear evidence that that is safe either, but indeed not that it's causing any significant harm either, just to say that questions have been
But
raised.
again, just to be very clear, massively less risky than smoking.
Yeah, it hasn't got those other components.
So, again, to Professor Newton and Professor Leng, so in one of our earlier sessions it became clear that there is no coherent e-cigarette policy across mental health trusts. This is about the use of e-cigarettes to help service users to stop smoking, although they all apparently base their policy on the same guidance. Do you think there should be some clearer central guidance, perhaps not only from Public Health England, but from NHS England, who appeared to be very reluctant to come to give evidence to us? It seems extraordinary to me that a third of mental health trusts, according to our survey, ban the use of e-cigarettes, given the evidence that you have both given to us this morning about relative risk. Can I have your view, perhaps starting with you, John?
Well, we've provided guidance to NHS trusts, including mental health trusts, and to employers on the basis for which they should produce their own policies. We do think there's value in individual organisations developing their own policies based on a general understanding of the evidence, because they're more likely to know what the particular circumstances are. But I would agree with you that it seems unlikely that an overall ban is the right approach, given the evidence. What we would like to see is that any smoker who finds themselves in an NHS trust and has an opportunity to quit using e-cigarettes, if that's what they're choosing to use. I'm actually pleased to say that just today the NCSCT has published this document, which is...
what is the NCSCT?
It's the National Centre for Smoking Cessation and Training. Okay. Has published guidance on good practice for mental health services, which is published today. So this is useful guidance, but it's not...
and it encourages the use of e-cigarettes to help people stop.
It provides guidance on the use of e-cigarettes. Yeah, it does.
Gillian?
NICE published several years ago now some guidance on stopping smoking in an acute maternity and mental health setting, and I think that's done a lot to support the reduction in use of smoking tobacco. But I went back to check what we'd said about nicotine replacement products, and it was far enough back for it to have focused on licensed nicotine containing products, and we advise that licensed nicotine containing products are available. We advise that they're on sale to encourage and support people stopping smoking. But it clearly is now a bit out of date, and so as a support from NICE for this, we need to go back and reference in that context what we've now said
will you
about
do that?
e-cigarettes. Yes, we will.
Over what timescale?
I would prefer not to be put on the spot around a timescale.
I want to put
as
you
soon
on
as
the
we
spot.
can, as soon as we can, even if it's just a short-term
Stephen.
amendment.
I think it's very interesting what you're all saying. I assume you all think that e-cigarettes, you've said it, are considerably safer than smoking ordinary tobacco products. But being all professionals and concerned about our ongoing well-being, is there a danger at this stage that while you say that e-cigarettes are potentially 95% safer than smoking tobacco, that then the buts and cautionary approach, and we're not sure what the long-term effect and the flavours and the nicotine, etc., actually drowns out the key message, which is this product is 95% safer than smoking tobacco, you should move on to that, and then we'll worry about that 5% risk at some later point. Because there is a perception that still prevails that e-cigarettes are not much safer than smoking tobacco. And I just wonder if that's because you're, as professionals, you always want to give us the precautionary, the caveats, but actually that's drowning out the key message that is a safer product. Would you care to comment?
Well, I mean, I think you're absolutely right. Getting that balance right is crucial. It's right to be cautious. It's right to keep an open mind. But as the evidence accrues, the position needs to shift and perhaps to be a little bit more firm about the relative lack of harm. And we avoid using the word safe because it's a very difficult word to use. But there's no doubt that using an e-cigarette regularly is much less harmful than smoking cigarettes, and it's important to get that message across, particularly to smokers.
Yes.
And you would, and given that smoking is the biggest single cause of inequality of life expectancy for people with severe and enduring mental ill health, you would presumably want to send out, following Stephen's point, a really clear message to mental health trusts to end these ridiculous bans and to start to enable people to give up smoking through the use of e-cigarettes. Is that right?
Well, we certainly think the NHS has an important role to play, and a clear message from the NHS about the use of e-cigarettes would be helpful. But it's not our position to tell NHS trusts what they should do. But we do think
it is your position to give clear guidance on public health matters.
It is.
Yes. I want to hear what that clear guidance is on the use of e-cigarettes for mental health inpatients.
Well, we do think that that there is a misconception about safety, and that all NHS trusts, including mental health trusts, should not put obstacles in the way of a smoker who wants to use e-cigarettes to quit. And so we would like to see them providing opportunities for patients to use e-cigarettes if that's what they wish to do.
Thank you, Darren.
Just a quick point on how do you get the message out? I mean, we're talking about the content of the message, but how do you deliver it? Because if smokers aren't going to see their GP about cessation services, or if you're a young person that doesn't get involved in the health service very much, how do you deliver that message to people so that they know?
Well, Public Health England has a significant social marketing group, and we undertake significant amounts of campaigning. We use a range of methods, including social media. I think, and we consult with both academics and industry partners in how to get messages across. So I think getting the message across is sort of meat and drink for our social marketing group. How you change behaviour is much more than just getting the message across. And I think there are many other organisations and parts of wider society that have a role to play there, apart from just us putting out messages.
Thank you. Liz, very briefly, and then Damien.
I say this as an ex-smoker, if you want to give up, though, you can get your gum on prescription, or you can go and buy it in the pharmacy, and lots of people, if they want to quit, go into the pharmacy and get something to stop them wanting it. So the point is, would they ever be available on prescription? Would they be available to be sold in Superdrug or Boots or Lloyd's Pharmacy? Because that is how other people get help, either on prescription or by going in and buying it. Is that on the cards?
I think this is perhaps a question for you, Ian.
I think we're then getting back to the medicines route potentially
So for it to be on prescription, it needs to be medically authorised, and so far no product has been medically authorised. Is that right?
Well, products been authorised, the two products have gone through that route, but they haven't been marketed for one reason or another. Okay. I think there are pros and cons of the medicines route versus the notification scheme. There are limitations in the notification scheme in terms of the tank side refill strength, etc., in terms of advertising, etc., and ability to prescribe put on prescription. The medicines route would get round some of those, but it comes with more requirements on the company, who have to produce a full quality dossier for us.
And I think
we'll
come back to that a little later on. I'm conscious of time. Can I bring in Damien?
This is Mr. Morrison. We understand that new guidance on e-cigarettes is soon to be published by the ASA following public consultation. So you're able to give us an indication of the flow of that?
Yes, so I can explain a little bit of the background. We have a rule which prohibits both health and medicinal claims. So medicinal claims would be those that Dr. Hudson is talking about in terms of smoking cessation, which reflects the law in this area. There isn't really anything we can do to change that. That's medicines regulation. We, on the basis of evidence that we saw in our consultation in 2014, we also prohibit health claims, and these are the kind of less harmful, safer than tobacco kinds of claims, because of very real concerns at that stage about the quality and safety of the products that were on the market at that time. Clearly, we are in a different place now. So we conducted a call for evidence in, I think, late 2016, and a consultation at the end of last year on a proposal to row that back slightly, to allow marketers to make claims that they can substantiate, which concern health. So this would potentially open the door for marketers to talk about products being less harmful than smoked tobacco, but in circumstances only where they have robust evidence that shows that their product is tested and TPD compliant and meets those standards, and they have evidence that shows that, and they've undertaken a comparative analysis. And we think that the market is probably getting to a point now that TPD is in where there are certainly some manufacturers who will want to do that. In terms of the flow of consultation, we consulted on that proposal. We're still taking that through evaluation. It's fair to say, I think, that the majority of voices in numeric terms are making the strong, forceful public health arguments that I'm sure you've heard at this committee table. There are other arguments from a vocal minority of experts that are still there that we have to weigh up as well, and it's perhaps maybe worth just summarising what those are. It's worth remembering, I think, that the statutory environment is quite cautionary about e-cigarette advertising. We have a tobacco products directive which prohibits advertising in vast swathes of cross-border media. It prohibits these kinds of health claims being made on product packaging or in the leaflets.
It's hard to understand any rational justification for different rules to apply to television to a cinema.
Indeed, yes. So that is the effect of the European law. So the kind of operative logic to it is that the jurisdiction of the European law is limited to media which cross borders. So broadcast media, online, those media that are purely domestic, newspapers, not newspapers, posters, leaflets, things like that, direct mail, cinema. Are out with scope.
Post-Brexit, would you welcome a review of that?
I don't think we have a particular view on the law that is what it is. I think there would be obviously an interesting conversation to be had about whether it's effective and what it's achieving, for sure. In terms of so there's this, to talk about the statutory environment, it is somewhat cautionary about that. It prohibits claims on pack. We have medicines legislation which obviously prohibits smoking cessation and reduction claims. There is, however, room for this kind of limited claim about potentially about products being safer than tobacco. But the message that comes across in consultation from this, as I say, vocal minority, is that e-cigarettes may well be safer than tobacco. They are by no means safe. They accrue no positive health benefits whatsoever, and that their benefits really only start when one transplants.
Other than saving lives.
But they have no positive. They have no inherently positive effect, and that's important when one thinks about how they're communicated about.
Carry on, and then I'll bring.
No, it's okay. So they aren't in any sense good for people beyond that benefit, and there isn't any benefit from them being used alongside tobacco. So it is only really when one transitions from tobacco entirely to e-cigarettes that,
even if it reduces the amount of tobacco consumed.
My understanding is that that's what the evidence shows, and that's what we've certainly heard in consultation. What that collective message from those respondents is that it is very difficult to manage the message that something is only desirable or safe in very specific circumstances, and by comparison with something else that is very harmful. And that's a difficult message to manage in an ad, in a one-to-many communication. So those are just some of the arguments that we've heard on that side of the debate.
We'll bring Stephen very quickly and then back to Damien.
Thank you. The evidence I think we heard, I'm always willing to be contradicted, was that there is no evidence that e-cigarettes are encouraging people to take up smoking or take up. People might experiment with an e-cigarette, but they don't tend to take it up if they haven't previously been a smoker. So it tends to be targeted at smokers. Is there not a way of balancing the communication with smokers rather than with the wider public? Perhaps looking at, we've now moved to plain packaging. Yes, smokers play top trumps with who can do each other with the pictures on the packets. Surely that's an opportunity to communicate directly with smokers, smoking cessation services, but also potentially advertising a product that is of reduced harm or relative harm, and also the pack inserts, which were banned under, I think, regulation. Again, that would only communicate with someone who has opened a packet of cigarettes and could therefore lead them to a product that is less harmful. Are those areas that could be looked at?
From our point of view, we wouldn't regulate product pack or insert, so there might be others on the panel who want to speak to that point. In terms of the types of messaging, we can set proportionate controls over the kinds of messages that ads include. I think we would need some sort of statutory backing in order to mandate sort of messaging to smokers, particularly given that smoking cessation claims would be illegal for this product categories.
Thank you.
Thanks very much. Damien?
Just so on that then, do you think there might be changes that might be afoot? Obviously they're not selling the health benefits, but they are more healthy in comparison to something else that someone might be using, which is the first point. And the second point is, was there a consensus in the consultation?
So certainly, in answer to your first question, that's certainly was the basis of our proposal, is to allow marketers who've got a good product, which they have comprehensive evidence about the effects for, to be able to say things like potentially healthier than smoking, less harmful than smoking. I think there's an attendant question there about the nuances of that message. So whether safer is desirable, or whether something like less harmful is a more desirable message. And those, I suspect, as and when we go ahead and make that change, are issues that might be things that the ASA has to look at in the individual casework that it sees with different ads. To your second question, we're obviously still going through evaluation, but our bias is certainly for our proposal. So to move to that point, at this point, we're really looking to see whether there are any showstoppers in the arguments. So that's where we're.
Thanks very much indeed. Bill.
Thanks very much, Chair. John partly answered this question, and it's sort of across the board. To what extent does your organisation work or promote to take account of the potential for e-cigarettes to be a cessation tool for smoking? What efforts do you make to promote that and engender that? And should we as a nation recognise more positively the ability of e-cigarettes to reduce conventional smoking and the ensuing harm that we're all clear in our minds that conventional smoking brings? Should we be pushing this? What are you doing in that area?
Shall I start? Well, I mean, we are e-cigarettes are the most popular quitting aid among smokers. So whatever we think of the evidence of their effectiveness, smokers are choosing to use e-cigarettes much more widely than other available forms, such as the Nicorette gum and the nicotine-containing gums and so on. So there's no doubt that they're popular among smokers, and the first step to being an effective aid is they have to be used by smokers. So that's very much in their favour. We have recognised that by introducing references to e-cigarettes in our campaigns, and in the Stoptober campaign, which is a very effective and widely copied internationally campaign, for the first time we had some video of a smoker using an e-cigarette, and this was quite a prominent feature of the coverage of the campaign. So we are introducing messages about e-cigarettes on the basis that smokers are choosing to use them. At the same time, we do have to recognise that e-cigarettes are not risk-free, and so we do have to be cautious. There is also a lack of hard randomised control trial evidence of their effectiveness in cessation, but the evidence from observational studies, which are quite convincing, is that many smokers have used e-cigarettes to quit. And to quit smoking completely, not just to dual use. So we need to continue to build the evidence base, but at the same time I think we do need to be clear that this is for smokers, particularly ones who've tried to quit before. If they haven't tried an e-cigarette, they should try an e-cigarette, because that might be their route out of smoking.
Yeah.
I think our role is more the regulation of the individual products to make sure that whether the e-cigarettes or even the gums, etc., comply with the relevant regulations, and then deal with any safety issues as they may or may not emerge as rapidly as possible.
I often say that developing the guidance is the easy bit and getting it used is the hard bit. But on this occasion, it's quite a challenging piece of guidance to develop. But in terms of getting it used, we work closely with Public Health England. We have dissemination routes out to GPs. We have a quality standard that promotes its use as well. We communicate with the local government association. So we do a lot of work around dissemination and reinforcement. Ongoing challenge is measuring the impact and getting data back on that. It's a collaborative effort.
In terms of the smoking cessation part of your question, we, as I said before, the smoking cessation claims can't be made for these kinds of products. What we can do is to change the rules to allow perhaps a window for these health claims, which is what we're doing in consultation at the moment, and hopefully there'll be something to say on that in the next couple of months. Yeah.
What's the timescale, Rob, for completing this and actually getting the guidance changed?
We're just finishing the evaluation process with our committees. I'd hope in the next couple of months we'll be in a position to publish something.
And that, when you say publish something, that would actually change the guidance?
That would be the proposed change to the rules that we're
proposed change or the actual?
Sorry, that was the change that we proposed to the rules,
okay.
and that's where, as I say, hoping to do. It is not yet, obviously, it hasn't been taken through the full evaluation by our committees yet, so I can't obviously guarantee the outcome.
Sure.
That was our proposal.
Thank you, Bill.
I think that all the panel members reckon, Gillian in particular, is that there's a 5% gap in the knowledge of maybe the long-term harm of e-cigarettes. So what endeavours are your organisations undertaking to try and bridge that knowledge gap and bring it holistically in? Or is there a dependency on the tobacco industry and the vaping industry to bridge that gap? Or do we need to wait this long time, I think, that was mentioned?
Well, we're trying our best to get the message across, and working with a lot of partners as well. So charities, for example, Cancer Research UK are also very active. So we're using every possible route to get the message across to smokers in particular that e-cigarettes are likely to be much less harmful, and to encourage them to use them. Actually, another route I perhaps should have mentioned is through specialists, through the smoking cessation services commissioned by local authorities, because they have a very important role to play. We know that smokers have the best chance of quitting if they are supported through such a service. So we'd like to see e-cigarettes available through the smoking cessation services alongside other nicotine replacement options.
It would be good to be clear that we were going to be able to have long-term data on both the benefits and harms of e-cigarettes. I think that's really important, as well as other research questions like the impact of exposure, if there is any, to second-hand vapour. Is that a problem? And the effectiveness of smoking cessation aids. It would be that there is relatively small amounts of data at this point because they're new products, and I think that research is important.
So that knowledge gap remains unbridged?
The long term absolutely does, because they're new products.
Yeah.
Public Health England has a commitment under the Tobacco Control Plan to review the evidence every year. So as the evidence is updated, we review it and we'll publish the results.
Just a brief supplementary here. I note in discussions that there's this public perception, maybe the conventional smokers' perception, that there's a greater risk from e-cigarettes. Is that possible that emanates from when you see somebody using an e-cigarette, there's the emissions, it's that they're buried in this great cloud? Could that be giving out the wrong message, that because of the sheer volume of smoke, that people perceive that to be more harmful when evidence suggests that it's not? Where is this negative vibe coming from?
I think it's an interesting question. I think it may be different for different people. There are certainly some. One has to be aware that people who are not smokers find the vapour from e-cigarettes sometimes unacceptable. They don't particularly like it. But there is. It's worth stressing there is no evidence of harm, in the way that there is clear evidence of harm. Second-hand smoke from tobacco is harmful. There is no evidence that exposure to the vapour from e-cigarettes is harmful. But that's not to say that some people don't necessarily like it. And
they may perceive it as a passive risk that's been promoted so much. Any other comments?
I can't comment on where the perception of the cloud comes from. I suppose on the safety issues, of course, the manufacturers have a clear responsibility for the safety of their products. we also run the we have responsibilities for the safety side in terms of monitoring any safety issues that are reported to us, and we've also been doing some work to promote reporting of safety issues through social media campaigns, working with the industry, newsletters, etc. So trying to encourage people to report to us any safety issues they experience.
Thank you very much.
John, the assertion was made yesterday at a vaping forum at the King's Fund that I attended, that only 1 or 2 public health directors around the country had actually gone out and published clear messages in their locality about the relative safety of e-cigarettes as opposed to smoking. Have you directly lobbied, communicated with directors of public health around the country that they should be doing this? And if not, could you?
Well, we produce, we talk regularly to directors of public health. We produce a whole series of outputs for them. We tend to package it up and put it out together. We've had debates with directors of public health. There's a spectrum of views amongst directors of public health. I don't recognise those numbers. I would say it's a small minority of directors of public health who have taken a more cautious role and who.
But do you encourage them to be proactive? We do.
We produce. We make it very clear in our outputs. For example, in the way we publish the latest evidence update, that we think e-cigarettes should be part of all local smoking tobacco control policies, and they should be used appropriately as an option. So we do make it very clear to our DPH
Thank
colleagues.
you. Neil?
Thank you. This is mainly a question for Dr. Hudson. Some people have raised concerns about short fills, so-called short fills, because of the concern that people might top them up with unregulated substances that might be harmful. Do you share those concerns?
I think we'll have to see the evidence as it emerges. Certainly the industry, or there's been a significant growth in short fills over the course of last year. Short fills don't fall within the notification scheme, the regulations, and I think over the longer term we'll have to see where this goes. Some of the industry have been, thinking about introducing a voluntary registration scheme for the short fills that don't contain nicotine. But I think it's something we'll need to think very carefully about and watch very carefully the direction it's going. But at the moment, it's outside the notification scheme.
And on that subject, you have told this committee that the short fill market reduces costs for producers because the only products requiring notification are the 10 millilitre nicotine shots. Is that lower cost incentivising e-cigarette producers to keep pushing short fills, do you think?
I wouldn't like to comment on the cost side of things, but I know it's a trend that we've seen in the latter part of this year where more people have gone to the short fills than not containing nicotine. Whether that will be sustained or not, I don't know.
But just to push a little bit on that, do you think that's driven by the fact that they then don't have to go through the licensing thing, or is it driven by the consumer desire to have a uppable product?
I don't think I'm qualified to comment what's driving it. It's an observation from our point of view that this is the way that industry has been going.
Okay. In your letter to us, you also state that the MHRA is collaborating with the Department of Health and Public Health England to carry out research into the safety of e-cigarette products. Can you tell us a bit more about that research and what piece of, what knowledge gap is it specifically trying to fill?
Well, we're doing a number of things. One of the things we're doing is working with Trading Standards Institute in relation to sampling of products such that they can be tested and to confirm that they comply with the regulations and notifications, also to make sure that there are no banned substances in there. So that's an area of work that we are doing with Trading Standards.
So you go and literally buy things on the high street and test whether they are living up to regulations?
That's the plan, yes, with Trading Standards to do that, to do a sampling. We can't test directly, but we're working with Trading Standards to do a pilot of testing to ensure compliance, yes.
And is that the main new thing that a bit of research does, the actual testing of what's out there in the field? Or
Well, there's a number of things. I mean, clearly I mentioned our safety reporting regime and any signals from that. We're getting intelligence from, in some cases, from the industry sector itself about people selling higher strength where that's banned under the regulations. There we are taking action, again, with the trading standards and indeed with the sellers if it's online. To make sure, one, the companies are brought into compliance and trading standards can follow up and take action. So we're taking action in a number of areas to ensure people come into compliance and if there are safety issues that they are dealt with rapidly.
One last quick question, which is, are you finding how prevalent are very high dosage products or illegally high dosage products, and how high a dose are you seeing on the streets?
Well, available online to consumers, I think we've had something like 4 cases that we've become aware of that we've reported to trading standards. So certainly that's been the experience to date.
Thank you very much.
Can I just ask, do you impose packaging requirements in terms of warnings, health warnings?
There are some packaging requirements on the notification scheme, yes, in relation to nicotine and nicotine being...
And what does the warning say on an e-cigarette packaging?
That it contains nicotine and that nicotine can be addictive. I think the wording is, and they have to write to you with the specific wording. But these are things that are specified in the regulations specifically that we do have to put on the packaging.
So it's just wording?
Wording.
Okay.
Yes.
Thank you.
Right.
Carol?
Chair, can I? Sorry. Can I ask you about a couple of things you've just mentioned? The 4 cases that were reported to trading standards, was that because of particularly high levels of nicotine?
Yes.
And is it not the case that in other countries nicotine levels are able to be higher than they are here, and actually they've been more effective to help people stop smoking?
Well, the European regulations on the notification scheme apply equally to all countries in Europe. That said, I suspect different countries in Europe are at different stages of implementation of those regulations, but the limits of 20 milligrams per mil and the refill size of 10 mils, etc., that is in the regulations, so that is applicable across Europe. I'm not sure which countries you're referring to. Certainly if you want to go outside of those, the other route is via the medicines licensing route that we've touched on 1 or 2 times already.
We heard evidence in a previous session, and I believe the US has much higher levels of nicotine, or allows much higher levels of nicotine in their products. So, I mean, I don't know, is this something that is likely to be considered here?
Well, the alternate...
Or in Europe?
Well, the alternate... Well, I think in relation to the regulation, where we currently are at the notification scheme as affecting e-cigarettes, is that it came fully into effect in May of 17, a year of transition from May 16 onwards. It's relatively early days, I think, for the scheme, and clearly as we go forward we'll have to reflect on how well it's working or not. I think it's premature at this point, having only fairly recently come in, to be suggesting major changes. And I don't think there are any plans for any significant changes as such, but clearly, as with all regulations, it's something we'll have to reflect on the implementation going forward. In terms of the US scheme, I don't think I'm competent to talk about that, but what I would say is clearly the e-cigarette notification scheme has some limits, and then we come back to, if you want to go outside that, the medicines licensing route is an alternate route, although it's not being used.
Okay. Just to go back to the notification scheme, you mentioned that short fills are not currently included in that, and you talked about the possible voluntary inclusion or voluntary notification. Is there a case for mandatory notification of short fills in the future?
Well, I think this comes back to the comment that I was making, is that the scheme has relatively recently come in, fully into force May 17. I think we'll have to see the way the trend goes. Certainly it's something that's grown significantly, the short fills, in the latter part of last year. We're going to have to see the way the sector goes and reflect on that, and take a view at some point in the future if this is a growing trend that does require some action or not. But at the moment it falls outside the scope of the regulation that we operate within.
Okay. Apologies, Dr. Hudson, I've got other questions for you. So, in your letter to the committee, you stated that your regulatory revenue of £5 million annually is likely to decrease due to market innovation. What do you mean by market innovation, and how would that allow producers not to have to notify MHRA of new products?
Well, it comes back partly to the short fill. I think where we are in the whole process of fees is we made some assumptions at the start of the scheme. I think we were way out in terms of our estimates of the volumes that we would receive. So we put a fee regime in place that included an initial notification, an annual fee, and a substantial modification fee. Given that we were way out, we've not charged the substantial modification fee, we've not charged the annual fee, and we're going to be reviewing the fees during the course of this year. As we've just been discussing, short fills, of course, have come on, have grown significantly the latter part of last year. And I think we'll have to see what the impact of that will be on the refill containers, whether we will still see the same number of refill containers, etc. And that's really what we're talking about here, whether it will have an impact on that. I'm not sure we're quite yet at steady state, but clearly we are going to be looking at the trends of the notifications and then taking a view on what our fee levels might be when we feel that we're a bit more able to predict what's likely to come. So we cover the costs, but just cover the costs.
Okay, so you're not looking to make money just...
No. We're looking to pay for the effort it takes us to do the notification scheme, the vigilance function that we have to do, and the systems that support that, etc. That's what we're aiming to cover the costs as a normal approach to regulation.
Okay, thank you.
Thank you. Darren?
Thanks, Chair. I just want to put a bit on medical licensing, because I think, to go to Liz's question earlier, from a consumer perspective, if you're getting something from the GP or the chemist, you inherently trust that it's safer than the cigarette, right? But to get e-cigarettes, you don't go to those avenues. And so I think it's interesting from a marketing perspective and trying to build trust perspective that this medical licensing route hasn't actually been followed. What are the pros and cons of medical licensing for e-cigarettes as licensed devices?
As you say, I think there are pros and cons of the notification versus the medicines licensing. The potential advantages of medicines licensing would include the claims that can be made, the health claims, things like gum patches, etc., have smoking cessation or harm reduction claims and can be promoted as such. Advertising restrictions would be different. They'd be able to promote a bit more in relation to the claims for medicines use. Available on prescription, of course, is the other one in relation to if these were authorised as medicines. The cons, if you like, are that companies have to provide a full quality dossier, GMP license, good manufacturing product licenses, tox data, full package, and a pharmacokinetic study bridging to an existing licensed product of some sort, and then ongoing obligations in relation to batch release, etc. So a more onerous, if you like, dossier to start with, then some advantages in relation to claims, promotion, etc., advertising, as a consequence of doing that. So those are the pros and cons. We have been working with, and we're doing a number of things to re-look at this, to see what we can do to see if we can encourage more people to go through the medicines licensing route. We're working with the trade associations to really discuss with them where they see the hurdles, any problems. We've given scientific advice to a number of companies, and we're following up those companies that have come to see us in relation to So where are you going with your products? Are you interested or not in taking this forward? We are doing a myth-busting guidance to make sure that people are quite clear actually what we're asking for. We're not looking for long-term randomised controlled trials, for example. We're looking for a pharmacokinetic study comparing nicotine levels with an established product. So we'll do that. So a number of things we're doing to try to re-look at and encourage people to use the medicines route again, because of the potential advantages we've been talking about. But to date, there's been very little very little interest in going that route since the e-cigarette notification scheme came in.
One of the pieces of evidence we had from some of the companies was the speed at which the market's developing and technologies are changing, and the slow comparison with actually getting medical licensing approvals. Do you agree with that? And if you do you think there'll be changes that you might be able to make in order to allow licensing to keep up with market changes?
I think that is a challenge, and we'll see whether the rate of change is sustained with e-cigarettes over time, or whether it's because they're relatively new. It does take longer to go through the generation of the evidence for a medicine and through the review process.
How long would a normal cycle be for that?
For
the authorization?
The review period is anything up to 210 days. We're very happy to, if it's a good dossier, it could be shorter than that. But it depends what the quality of the application that's put in to us, depends what it is. But it's the time it takes to do the pharmacokinetic study, etc., that the company would need to do.
So over a year at least?
Oh yes, it takes a while, and if the speed of change is very rapid, then yes, I think that is something that is a challenge.
Okay, and in terms of the advice that NICE and Public Health England could give if a provider started going down this licensing route, how would that change what you would be able to do in terms of promoting it for smokers?
Well, we think both licensing routes have advantages for some of the reasons you've discussed. We wouldn't want to see it only medicinal or only consumer, and we would like to see a medicinally licensed product because, for the reasons you said, it would send a stronger message about safety, relative safety, and it would also provide another avenue and help, for example, smoking cessation services to use e-cigarettes more. So we think there would be considerable advantages if there was a medically licensed product.
Well, just to echo that, really much more straightforward for NICE because there'd be a strong evidence base. We'd be reassured around the safety. But we also know that GPs would find it reassuring and it would give them the ability to prescribe the product. There is also, though, the need for, I think, a number of different options because not speaking as NICE particularly now, but speaking as someone who's looked at all the websites, because if you look at the websites for e-cigarettes, they're described as edgy products. They're exciting, they're different, and there inevitably is a group of smokers who will be attracted to that, and others will be attracted to the clear clarity around a licensed safe product.
And Rob, just on the Advertising Standards Authority consultation, if you relax some of the rules on some of the claims that can be made, have you considered whether that will have a negative impact on potentially going down the licensing route, which could ultimately help with cessation, as we just said?
I don't think we'll try to look that far ahead. We know obviously at the moment that the licensing route hasn't really been used thus far, despite what's going on. Certainly it's not our intention to drive people away from that route, but simply to reflect the things that we're hearing from experts, which are that the market, the consumer market, is probably in a place where it can substantiate those kinds of general health claims for its products.
And have you had any evidence or submissions to the consultation which raise that concern?
I would need to look through them in detail, but I don't think that specific concern has been raised. No.
Okay, thank you.
Thanks very much indeed, Liz. Conscious we got the minister waiting. Want to make sure that Liz's questions are answered properly, but just can you all just make sure that you keep as succinct as possible?
The committee had some evidence that there's a difference between how younger and older people view the harmfulness of e-cigarettes. Do you think that's a problem? And if so, what should we do about it?
Yes, it is. It's interesting, isn't it? it is a problem. It's not just older people. There's also different levels of education and social background, which is so inequalities in smoking are apparently partly driven by this difference in opinion, and I think it just comes back to our previous points that we need to do everything we can to address misconceptions about relative harm. But definitely it is a problem.
Do you mean that people who are older and or on lower incomes who may be more likely to smoke are more likely to think these are harmful?
Yes, so people on lower incomes...
The people who need it most
exactly.
are most likely to think it's not going to be very good for them.
Yes, well certainly older people who are on lower incomes where smoking prevalence is higher and there are more barriers to quitting in general, they are less likely to think...
Why do they think that?
I think it's
because they think the action is bound to be bad for them. What is it? And have you done any research into it? Because unless we understand why they think it's harmful and they're the people who most need it, would you do any research on this so that we can change it?
Well, the short answer is I don't think we know, and it would be an excellent topic for research. We don't commission research, but it would be a very good topic for further qualitative research.
Who does?
Well, it would be either the Research UK or the under research councils, one of the charities, or the National Institute for the NIHR.
Thank you very much. Stephen.
Thank you. And just a final question from me, because our inquiry, as well as covering e-cigarettes, covers heat-not-burn products, other novel products. Can you tell us what you're thinking on heat-not-burn is so far, and where that sits in on the relative harm or the scale compared with smoking traditional tobacco?
I can talk very briefly about the advertising position. The heat-not-burn is a tobacco product. Tobacco products are prohibited from being advertised, so we have not yet seen an example of a brand or product being advertised in any of the media we regulate. We do have under investigation at the moment, and this was reported in the press this week, an ad by a tobacco company which is talking in general terms, a sort of comment piece about the relative harms of relative safety of heat-not-burn. We are looking at the moment about the applicability of the tobacco prohibitions to that, but I think there was also reported this week some concerns about the Philip Morris product, the IQOS, being advertised in store posters and so forth. Those are where material is advertised in store, it falls in the remit of trading standards, and they are looking at that. We'll be looking to make sure that we understand where that gets to and follow up with them on that.
Okay, thank you.
Well, I think we need to be very cautious about heat-not-burn products. They contain tobacco, and we just don't have very much evidence. There is a Committee on Toxicity report that suggests that there will be residual harm from heat-not-burn, so I think we just need to be very cautious about it.
But can you comment specifically on the relative harm compared to smoking?
Well, I don't think we know enough. I mean, they're likely to be somewhat less harmful than smoking cigarettes because they don't contain quite as many toxicants, but they do. The vapour from heat-not-burn products does contain more toxicants than e-cigarettes, so they're somewhere in between smoking tobacco and e-cigarettes, but where exactly they are, I think is difficult to know.
Okay, thank you.
It doesn't fall within our scope. These are not e-cigarettes. So,
I'm not sure of the answer. I imagine they would be more harmful than e-cigarettes. They've got tobacco in. We have a guideline on smokeless tobacco, which was all about people who chew tobacco. That has carcinogenic effects. That's without any heating at all. So it's hard to imagine that the heat-not-burn product is going to be good for you.
But will you... Sorry, Stephen, go on.
It's this issue of relativity that we've got a huge body of evidence about the harm that smoking cigarettes causes, and no one's debating that. It's how you move people from smoking cigarettes, how we deal with that last 16%, those who are the hard to reach. How do we move them, and does heat-not-burn have a part to play in that, and how do we, because apparently it sits It's more satisfying than an e-cigarette, but more harmful potentially. It's communicating to move smokers stage by stage towards, and you as professionals play a part in that to play a role in overall improving public health.
Well, I mean, as I say, it's early days, but it's likely that heat not burn are going to play a much smaller role in public health campaigns than e-cigarettes, because they contain tobacco, and therefore it's a much more...
But is this the burning of tobacco we have also been told that is particularly carcinogenic? Is that
well, again, I refer to the Committee on Toxicity looked at this, and their finding was pretty clear that there are residual harms from the toxicants contained in heat not burn. I'm not an expert on the toxicology, but...
Will you, Professor Leng, be updating your guidance when you update it on e-cigarettes, as you said you would? Will you also be providing guidance of your view on heat not burn?
Yeah, I will definitely take that back. There's also the smokeless tobacco guideline as well that we need to update. So I can't give you a time frame, but I'll take all these messages back to you.
Thank you very much.
Obviously.
Have you finished, Stephen?
I have, thank you.
Thank you. Very briefly, each of you introduce yourselves. Steve.
Hello, Chair. Yes,
Hello.
Steve Brine, Minister for Public Health and Prevention.
Thank you very much indeed.
I'm Tim Baxter. I'm Deputy Director for Healthy Behaviours, which covers alcohol, drugs, tobacco, sexual health and one or two other things.
Thank you. And can I apologise for keeping you both waiting? I understand that you need to try and get away by 11:30 if possible, so we'll try to stick to that if we can. I will start. The Tobacco Control Plan acknowledges a disparity in the prevalence of smoking between local communities, and that, and I quote, addressing the huge variation in harm across the country, close quote, disproportionately falls on vulnerable communities. How is the government working to ensure that local authorities with a higher number of smokers from disadvantaged backgrounds are properly supported to provide specialised smoking cessation services?
I'll start. Okay, well, I'll kick off, Mr. Lamb, and then Tim, who's got some over 4.5 years' experience of working in this area of policy, so he's very senior official you've got with me today. I would say that one of the first things I did was publish the Tobacco Control Plan. Why did I do that? Because it is still the biggest preventable killer. I am the cancer minister, I think that it is the pivot of my role in many ways, and smoking is still the biggest preventable killer in our country and the greatest cause of cancer deaths. So our view is that the best way for smokers to improve their health and to quit smoking and nicotine use is to stop smoking. We're putting significant resources through the public health grant, some £16 billion during this spending review period, into local authorities for their public health spend, and it's not uniform across the country, and it's not meant to be. The Health and Social Care Act that the coalition government passed, of course, devolved that back to local authorities, and it is not uniform across the country. And of course there have been savings to the public health grant, but we feel, and we felt as a government under the Prime Minister Cameron, that it is better for local authorities who know their areas best to take the use of that money and to put it together in a combined harm service, for instance. So in my county of Hampshire, they're exploring a new procurement around drug and alcohol and smoking services together, and in other areas it would be different. So in Leicester, for instance, there is a real trailblazing group of people in the public health team in Leicester who are achieving good things. But the prevalence of smoking in my county, maybe yours, is very different to some of our hotspots like Blackpool, for instance. So, it would be... Sometimes people look at local authority smoking cessation services and they think, they're not all doing it the same, and they shouldn't be, because smoking rates are different in different parts of the country. In Blackpool we have a particular challenge, for instance, with pregnant women smoking. So there is a different prescription and a different application of that money in that area. But we're investing heavily in the public health grant during the course of this spending review period, and rightly so.
Do you want to add
just to add that we have Public Health England, which works very closely with local authorities across the country, and they provide local authorities with not only the advice on best practice, but they also provide local health profiles which make it very clear to the local populations, local political leaders and others how they're doing. So if a local authority is frankly has got a high prevalence of smoking and is not investing in that area, then they will have to account locally for their investment decisions.
In terms of, we've been hearing evidence about the relative harm of smoking compared to e-cigarettes. The fact that, according to Public Health England, e-cigarettes are 95% less harmful. Would you want directors of public health around the country to be vocal and clear in promoting the value of smokers transferring to e-cigarettes because of that relative harm risk of one compared to the other?
Yes, and they do. There's no question that they do.
Yeah.
Okay. There's some evidence, or there are some assertions that it's very variable around the country, and that not all directors, indeed the majority of directors of public health, haven't been out there proselytising for the value of e-cigarettes.
Yeah, I mean, we were talking about this outside, weren't we? I mean, there are a few outriders, aren't there? But as well as Public Health England provide, which I'm minister responsible for, providing advice, and obviously us providing the money through the PH grant, they're all Public Health England, as we have seen in the way that they have recently put a scorecard up to Northamptonshire County Council, for instance. They are responsible to make sure that upper tier authorities, where we pass the public health responsibility and spend to, are actually spending the money on what they're meant to be spending it on. And when they don't, we are more than happy to come down on them. But do we mandate DPHs, Directors of Public Health, to say one thing? No.
But you would be encouraging them to get out there and make the case on e-cigarettes?
Yes, because the evidence is emerging, the evidence is not final, and the evidence is not complete, which is why we've said that Public Health England every year during this period through until 22 will do an annual evidence review on the work. But the evidence is clear, and the 95% figure we do not dispute. The Tobacco Control Plan commits us to the monitoring, the safety, the uptake, the impact and the effectiveness of e-cigarettes, and we're doing that. But where they can be part of the mix alongside stop smoking services, and that's the key thing. We wouldn't expect Directors of Public Health to say, here's the panacea, here's the golden bullet, and I don't think any of them would be naive enough to say that. We would expect them to bring forward proper harm reduction programs, and the evidence is, as I say, emerging, but we're clear that e-cigarettes can play and do play a big role in stopping people smoking, but only when it's combined with stop smoking services.
We would expect Directors of Public Health to be looking and engaging with the evidence, essentially.
Yeah. Okay, thank you. Now, you'll both be aware that the single biggest cause of the inequality of life expectancy for people with severe and enduring mental ill health is smoking. And that therefore we need to have a particular focus on reducing smoking levels, which have remained persistently high amongst people with mental ill health. Does it surprise you that our survey of mental health trusts shows that a third of NHS mental health trusts around the country ban e-cigarettes within their organisations? And does that strike you as odd, given the evidence that you've described?
I'll let Tim come in a minute. It doesn't surprise me, for the reason that generally hospitals do not allow vaping on hospital grounds. However, there's no legislation to enforce that. It's each hospital's decision. Fundamentally, this is a decision for individual organisations, and I know you're interested in the prison service, for instance, but that is a national prison service, as you well know from a previous incarnation, Mr. Lamb. The health service is a national health service, in practice devolved, and since the innovation of Foundation Trust, they are individual legal entities. But is there plenty of guidance from NICE, who you've heard from, I know, from CQC, from Public Health England? Absolutely there is.
But are you relaxed about a third of trusts not following the guidance that e-cigarettes should form a central part of efforts to help people give up smoking, particularly given that it's the single biggest cause of early death?
I think it's an issue for each organisation, and reflecting
that makes it a bit of a postcode lottery for people with mental health.
I think there's the commitment to a smoke-free state of the Mental Health Trust by the end of this year. Now, the trouble is what works in a particular sort of mental health trust in one place may not work so well in another. I mean, the mental health trusts I at one time knew well were the high secure forensic psychiatric hospitals, where it's amazing that they have made such progress in going towards smoke free. You can I was just reflecting on this in terms, I know you're asking about the mental health, but acute trusts, where you might say, well, why don't you have places on a ward where people could vape? Well, that will depend on the design of the ward and what other uses you might need for that space. So it's very difficult without actually interrogating further an individual trust. Well, why aren't you allowing?
So Nottingham, a representative from the Nottinghamshire Mental Health Trust came and gave evidence and talked about how the trial that they've run had won staff over, that it had been very effective in using e-cigarettes as a tool to help people give up smoking. And there is this sort of golden opportunity when someone is an inpatient to have an impact which might extend life. And yet you're just saying it's up to individual trusts what they do.
Well, they're saying, as the Minister said, we can't mandate.
You can't mandate, but it's about the guidance and whether you should be giving a clear steer.
I don't think they are short of guidance from us, and in my experience, trusts are not desperate for more guidance from the centre. I mean, the other way I look at this is I'm certainly not relaxed about this at all, and I have a very open mind on it. We have discussed this offline as well. I would say that what it says in the Tobacco Control Plan is that this is a particularly vulnerable group. It's a particular group that we are particularly interested in, as let's put it crudely, a low-hanging fruit maybe. So, but it's more becoming smoke-free is more. It's about trusts working to sort of end the culture, I suppose, in which smoking is used as a way to build relationships with patients. That's what we mean in the Tobacco Control Plan about mental health trusts. So, whereby cigarette smoking breaks are used as a reward, where staff and patients may have an interaction that they might not otherwise have. So it's about working with the experts and the public health experts of PHE on a sort of full range of evidence-based treatment options to support their quitting. Or their temporary abstinence while they're inpatients. And then, introducing through education around e-cigarettes, because very, very few people are permanent inpatients. Most people who are inpatient in a mental health unit soon become an outpatient to a mental health unit. And so is that every contact count agenda an opportunity to talk to them about the benefits of e-cigarette use? Absolutely, I would completely agree. Now PHE are commissioning a survey of all mental health trusts, which will ascertain compliance with the PH48, which Tim can talk forever about. But what would be helpful is if the evidence that you as a committee have gathered could join forces with PHE, and it'd be grateful if you would do that, because I think there's an opportunity there for us to work together.
And I suspect if you did that survey in a few months or maybe a year's time, I think the figures will move, because I think the evidence is is there.
Well,
And
that's why I'm encouraging you to be a bit more proactive,
Yeah.
not to mandate, but to send
Yeah.
messages to mental health trusts to follow the best practice and follow the evidence.
Yeah, I mean, I couldn't mandate without
And I'm not
changing
expecting you to.
the rules.
I'm expecting you to encourage.
But I am certainly wishing to encourage, for the reasons I've said, that I do think this is a low-hanging fruit, and it's an opportunity for every contact being made to count.
Thank you.
This is what the NHS surely must be about.
Thank you. Stephen.
Thank
Oh,
No, thank
I do apologise. you appeared shocked, and I apologise.
Good effort, though, Stephen.
Carol, I do apologise.
Yeah, I think I was more shocked because I need to read. Minister, we've looked at research by Cancer Research, who have talked about the spending on anti-tobacco campaigns and stop smoking services. In fact, they've said that the spending has decreased dramatically over the last 5 or 6 years. Is this because local authorities have other competing needs, or is it because central government is providing less money for these activities?
So there's two parts to your question. On the central marketing campaigns, I am seeing CR UK tomorrow, and this is one of the things I want to discuss with Harpole before he retires. Yes, it's true that there have been savings to the public health grant due to the state of the public finances that we inherited and still juggle, and that's one of the difficult decisions that we had to take when we came into office in 2010. But it's not true to say that we are, as some do, that we're not investing in campaigns. I mean, we give you the figure that we spent some £1.5 million in 16-17, estimated £2 million in 17-18. On PHE's social marketing campaigns, for example, Stoptober, which featured for the first time e-cigarette use, and I think that made a pretty excellent use of the resources available. And you estimate it's about 1 million made a quit attempt during Stoptober. So I think on the national
in 2016,
in 2016, for which we have the figures available. So I would say on the national side of things, it has been incredibly effective. For fear of repeating myself, Tim can come in a minute. On the issue of local authorities in England, there is a significant investment. I mentioned £16 billion in the public health, the ring-fenced public health grant. Yes, local authorities have competing priorities, but they don't where there is a ring-fenced public health grant. And as I've said, Leicester is a very good example. There are some very, very good examples of local authorities that are doing very well. Leicester is not, as I'm sure you know, the Leicester MPs, one of whom has a very direct interest in matters of health in England. Leicester MPs are not known for being a cheerleader for the government's policy. So therefore, Leicester does not have buckets more cash than my county or Mr. Lamb's county. It's how you use that cash and how you apply it to local priorities as to whether it's successful, and there are very good examples of it being successful. I appreciate that is not relevant to your constituency, but it is relevant to your inquiry.
Cancer Research UK showed that only 75% of local authorities were using e-cigarettes or promoting e-cigarettes as a method of stopping smoking. What are you doing to get the other 25% on board?
Building the evidence base, and making sure that we live up to the promises of the Tobacco Control Plan about year on year reviewing the evidence base, making sure that it gets stronger and stronger, so that it is a no-brainer for local authorities to make that decision.
But the evidence is clear enough for 75% of local authorities. Why is it not clear enough for the other 25%? Because
it is a devolved local decision. We're not mandating what local authorities should do. That is what Parliament decided to do when it passed the Health and Social Care Act.
Do you encourage them?
We do encourage them, and that's why I think it's important that we continue to build the evidence base.
Public Health England does a lot of work encouraging people around e-cigarettes, as you know, and you've heard from John Newton this morning.
You'd singled out Leicester, and it seems the work they're doing is very good in this area. But is there not a responsibility of government to actually try and influence the way in which local authorities are operating if it's considered that they are not doing enough for the public health in that area?
Yes, and that is why we continue to resource Public Health England, as you will have heard from John Newton earlier. That's why we resource Public Health England to the extent that we do, so that they build that expertise, that knowledge base, and they do. I mean, they're not a national organisation that just talks through the national media. They are also a locally devolved organisation that deep dives into local authorities. I mean, I wasn't here for your previous session, but I'm sure John would have said that. And if he didn't, it is true that they deep dive into local authorities and try and help them and try and encourage and mentor them to do the right thing by their areas, but only what is applicable for their local population, because what's applicable in, as I said, Blackpool and Leicester is not necessarily applicable in Hampshire and Kent. Did you want to add anything on that?
No, I think that puts it very well.
If I could just take you back to the figures you mentioned at the start there, I have some figures here as well, and I have figures that show in 2009 the government was spending £25 million per year on stop smoking campaigns. In 2016, the figure we have is £4 million per year. Is there a plan to increase that again? You've talked about the economies that you have to work within, but is there a plan to try and move back towards the £25 million per year?
Please do.
Well, in terms of the plan, that's obviously a ministerial political decision. I think the £4 million applies to the totality of Public Health England's spend. Yes, the money has reduced because for the reasons the minister has alluded to.
Significantly.
And I think we should always look at the outcomes, and I think the proxy outcomes for Stoptober have been incredibly good. They are reaching an enormous number of smokers, and we mentioned a number of smokers in 2016 who made a quit attempt. Now, yes, in theory, having a lot more money to spend on big TV campaigns would be very nice, but there are decisions about priorities to be made.
And if I could spend significantly more money on national advertising campaigns through national media, which is increasingly diluted by plurality of the media market in our country and online, I would actually have to say I'd think very long and hard before I would do that. Because, as I said, I think you've got to get a headline message which reaches a certain number of people, but you've also got to then combine that with local action. And so, if somebody gave me a choice between spending even more with ITV versus even more with each English county council, I think I'd have to think long and hard about that, Carol, to be honest.
Okay, thank you.
Stephen, your moment has come.
Thank you, Chair.
He's on.
I asked the previous panel about whether or not the message that e-cigarettes reduce harm by 95% was getting lost by potentially all the caveats that are then added to it because we don't have this evidence base. Could you confirm that the government supports that 95% harm reduction claim, and that actually wouldn't it be better if we had moved all smokers onto e-cigarettes and then we're worrying about what we do with that 5% risk and then gather even more evidence? Is there a danger that we are confusing the messages?
No, because I don't. I get criticised for not being the cheerleader for e-cigarettes. I don't think it's my job to be the cheerleader for a sector of industry necessarily, But then I also get criticised. So people in this house, and we had a debate in Westminster Hall not that long ago, saying that I should be much more cheerleader for e-cigarettes. I met with the Eliminate Cancer Initiative last week, which is working with me and Baroness Jow in the department on the new brain cancer work, and which is creating the new International Cancer Data Bank, which Tessa donated to last Thursday as the first person. They do not support e-cigarettes and would like me to go back. So therefore, you'd have to ask them. Okay. I just saw that in the headline in their information. So I don't think that. I think that our sort of pragmatic evidence base, keeping it constantly under review, puts us in a rather a sensible middle way, to be honest.
All right.
I mean, you know, something that's unfair, but you know, while also adhering to the European regulations, as long as we're a member state, which we do, I think actually we're in a good place.
Okay. All right. Thank you for that. Taking the point, though, that while you may not, and you know, for the reasons you explained, want to be the cheerleader for e-cigarettes, there are many, and we've heard lots of evidence that these are a significant harm reduction product. But we've also heard that doctors would feel more comfortable recommending e-cigarettes if they were medically licensed.
Yeah.
Is that something? But the industry itself may not see enough benefit from going down.
I don't think it does.
Is there something more that the government can do to bring those two parties together?
I'm not sure there's more that we can do to do that. If you wanted to, if you were a producer in this industry and you wanted to apply to the MHRA for a licence in order to have them, for instance, prescribed, then you could do that, and there is nothing to stop us doing that. I think we have the regulations in place. I don't think they're particularly onerous. I think that you can do that, and it has been done. Tim will come in a second. It has been done, but the company that did that decided then not to bring it to market. So, yeah, we're certainly not standing in the way, Stephen, of that happening. And I think we've got all the regulations in place. Do you want to expand on that? The company that did it was...
it was BAT with the Evoke product. So the Tobacco Control Plan had a commitment that we would work with the MHRA to make sure the process is fit for purpose. And I met with MHRA colleagues, and I think you will have heard from them this morning about the work they're doing. And so we can try and make sure that the process is clear, that the barriers you have to go and the hoops you have to jump through, etc., are clear. I think in the final analysis it is a matter for a commercial decision by a company. Is it worth our while spending the money and the time on this route where I can sell this product just as an ordinary commercial product? And we know that around 3 million people in the UK are using e-cigarettes of one sort or another.
And we committed in the TCP to ensure that the system was fit for purpose. I have looked, and I think it is. You know, and my officials have met with the MHRA, who engage with the e-cigarette industry to understand any of the challenges that they put forward in this area. But the fact remains that it's in the end, as Tim says, it is a commercial decision by the companies as to whether they wish to bring a product to market through the medicinal licence route. I wouldn't deny that having e-cigarettes available on prescription could be of benefit, but it is still a matter for companies to bring that forward, as it is with any medicine.
But do you think that's the only barrier for doctors prescribing it, that they would feel more comfortable if it was a medically licensed product? There's not a cost implication. It's better to get people to pay for their own e-cigarettes than put them on prescription. No evidence.
It is a fact. What you say, yes.
Is there any evidence that that's why doctors are not prescribing it?
Well, it's not a prescribable product.
They can't prescribe it. That's what I mean by it's fact.
Right, okay. Fine.
You can't prescribe something that doesn't have a medicinal license, and they don't have medicinal license. So,
what they can do is discuss with a smoker how the best they can sort of quit smoking, and say e-cigarettes are one route in.
And they do. I mean, I also look after primary care. I spend time sometimes sitting, poor patients concerned, but I spend time sometimes sitting in doctor's surgeries watching consultations with patients' permissions, I hasten to add. I was in one not long ago where somebody came in with the usual comorbidities, one of which was a challenge with smoking, and the GP had a conversation around e-cigarette use. And the patient went away more informed than they came in. It was a good place to be, but he didn't prescribe it because he couldn't.
Fine. Thank you. Thank you, Jim.
Thank you very much indeed. Bill?
Thank you. We'll all be aware that e-cigarettes are exempt from tobacco excise duty at the moment. Have you had any discussions with the Treasury going forward that would be the case for the future? Would you like to see it retained?
No. There are no current plans to change the current rates, 20% VAT on e-cigarettes. We think there's already a a large financial incentive for people to choose e-cigarettes over tobacco products. It is some 50% saving, which is significant, I would suggest. And the latter, of course, which pays a tobacco excise duty anyway. So HMRC issued guidance back in 10 years ago now, 2008, regarding the reduced rate of VAT for smoking cessation products. Now, where the MHRA approved medicinal e-cigarettes as pharmaceutical smoking cessation products, they then could be subject to a 5% VAT rate, I think I'm right in saying, if sold over the counter, or they would be zero rated if dispensed on prescription. But then that goes back to the point that Mr. Metcalfe raised around.
And that's I should add that that's always looked at on a case-by-case basis, so that is the general rule.
But I have to be honest and answer your question. No, there are not those discussions going on. We would also, of course, be subject to the rules of a member state in terms of changing VAT rules. That is, of course, about to end.
Yeah. We touched on it, Stephen touched on it. If indeed, in the event that one of these products did receive a medical licence,
yes,
would you be aware, would that continue the 5%? Would it just slot into the existing category?
There would be any particular, as our understanding, and this also is a Treasury issue, our understanding that that's the general rule. There would be any particular case they would look at, but the general rule is 5% for over the counter, 0% for a prescribed product.
Right.
VAT.
Right. Thank you
5% as a consumer product.
Yeah.
0
is for a medicinal.
Correct.
A prescribed product.
Prescribed medicinal product.
In line with current practice.
Thank you for answering the Treasury questions.
I know. God, sure way to end your career.
It's only just me. I've probably peaked at the moment.
Have you finished?
That's fine. Thank you, Chair. Yes.
Thank you very much. Now, can I just ask you a question, Steve, on snus? Current evidence would suggest that using snus is significantly less harmful than smoking, and yet across the EU it's banned, with the exception of Sweden. Now, the Health Secretary wrote to us recently in response to a letter from me, explaining that his main objection to the European Court of Justice snus case, you'll be aware that there's been a case in the ECJ, was based on the proportionality principle. It's rather a complex legal principle.
It is.
If we were outside the EU, do you think that the underlying evidence of the relative harmfulness of snus compared to smoking cigarettes, which is lawful in this country, would support a continued ban on it?
So I'll be very careful what I say, because it's an ongoing court case. You're absolutely right in presenting the fact that we did attend the hearing to present legal arguments around the proportionality in EU law. But that issue goes much wider than snus, I would add. So in terms of whether it continues to be banned across the EU, that's a matter of the ECJ, I understand, to decide, and they will make a decision later this year. In terms of post-Brexit, and does that give us more room for manoeuvre? Unquestionably, yes. It is a bit of take-back control that I don't remember seeing on any buses, but it is a fact that we would have more room for manoeuvre.
And do you have an open mind on that question?
Yes, I have a very open mind on most things.
Would you go further in saying that you see a case for ending the ban?
No, but I have an open mind.
It's worth trying to tempt you.
But keep trying.
More broadly, do you see scope for reviewing the regulations more generally on e-cigarettes post-Brexit, once we're no longer subject to the GDPR?
I might ask Tim to come in on this in a minute.
The Tobacco Control Directive.
The directive, yeah. I mean, at the moment, we are very good member state, and we comply nicely with the directive.
What about after?
The Secretary of State wrote. I have it here, which I will leave with the committee.
Do you want to just mention the page 27 of the Tobacco Control Plan has leaving the European Union, and just sets out a commitment that we have to review the tobacco and related products regulations anyway within 5 years. That's in the regulations. But in the context of Brexit, we will be reviewing the legislation to see where changes might be made. So there is that. There will be that review, and I think the challenge will be to identify where changes might be made which would continue to protect public health but might simplify, might deregulate and so on. So it was in particular, the government will assess recent legislation such as the Tobacco Products Directive, including as it applies to e-cigarettes, and consider where the UK's exit provides opportunity to alter the legislative provisions to provide for improved health outcomes within the UK context. It's not glittering prose, but that is a clear commitment that we will look at the legislation.
And I'll leave this to the committee, and it may be worth you citing in your reports. The Secretary of State wrote something for Politics Home last week around Britain wanting to continue to be a world leader in public health, and I'll just quote the relevant section. He said, "We've already committed to looking closely at legislation on tobacco control, including on e-cigarettes, to make sure we take opportunities to improve outcomes and protect health. We can be more ambitious for health improvement and public health, not less when we leave the EU." And that is most certainly the view of myself as the Public Health Minister, and I may have had a small hand in said article.
Thank you very much indeed. David.
So just moving on to the heat not burn products. We touched on it in the last section, and just moving on to it here. So both the Commission on Toxicity and Public Health have pointed to the lack of independent, rigorous research for their harmfulness to the user. So obviously reliable evidence is needed as soon as possible. So what more can be done to accurately quantify the risks of these devices and inform how we regulate and monitor them?
So I might ask you to come in on PHE's February 18 review, because I know that they had a chapter, didn't they, on heat not burn. But I mean, the evidence to date, Mr. Moore, suggests that heat not burn products, or novel tobacco products, as they're often do, still pose harm to users, but they are, they're likely to be less harmful than conventional cigarette smoking. But I mean, data on human health in this area is very, very limited. That's why our recommendation that smokers quit tobacco completely rather than move to heat not burn products. I'm sure the industry would disagree with that, but HMB it continues to be regulated as tobacco products under European legislation. At this stage, I would say we just don't have sufficient data to consider changing that regulatory approach, even if we were able to. So PHE are going to continue to monitor the evidence base as it develops. And the reason I make that point about them still being regulated as tobacco products, and you may have seen, Chairman, that there was some press coverage from me this weekend around PMIs, Philip Morris International, their IQOS device. Is that breaching tobacco advertising regulations through poster advertising? And I think that they are, and I wasn't shy in saying that this weekend, which picked up, not unsurprisingly, quite a lot of press interest. Do you want to start something on the PHE?
Yes, so
it mentioned heat not burn.
We got advice from the Committee on Toxicity, which published a short report last December. They looked at the evidence, and you're quite right. I mean, one of the problems in this area that most of the research has been done by PMI scientists, and so COT weren't able to say more than it appears to have much less percentage of harmful compounds. There's not the same issue with side stream smoke as with conventional cigarettes, but they weren't able to say, and it's X% safer or less harmful or anything like that. And so we do need to keep an eye on this. I think one thing I would say is that this is not a problem that we are grappling with on our own. So the Food and Drug Administration in the States, for example, are looking at an application for IQOS at the moment to see whether it will be A, marketed in the US, and B, whether they can make any reduced harm claims. Now that's going through the process as we speak, and I think one of the advantages of engaging as we do with other countries is that we are trying to share our experience, because tobacco industry is a global industry, and so as we need to try and be global and trying to draw on the evidence where it is. But as Minister says, at the moment they're regulated under the regulations and the directive. We've got to be very careful about making any assumptions about reduced harm. There's some evidence which is interesting, but we need more.
Okay, so we will look at evidence from other countries and potentially make a different assessment on that. And will there be any regulatory divergence after Brexit?
at TBC. Tim was in Cape Town 6 weeks ago.
Yeah.
At the international conference where I know this was discussed.
Yeah, so there was quite. I'm part of the Global Tobacco Regulators Forum, which brings together the Americans, the Canadians, the European Union, and various others, and that's the sort of forum where we do discuss these issues. And you won't be surprised to hear that heated tobacco products has been the subject of the last couple of face-to-face meetings. So we're all grappling with it. We're all trying to share intelligence and understanding, and we all want to see sort of further good research being done.
I think that I think I'm right in saying that of the 20 studies that have been conducted in this area, 12 were funded by the manufacturers.
Yeah. And then in looking at those, you then we would obviously take advice from PHE, for example, so how strong and robust are those studies? Have they been done according to FDA requirements, which are very stringent? And so, can we put any reliance on them or not?
Yeah, I mean, I think it's just a case of getting a bit more of a rounded approach to it, and more studies obviously are needed. And because I know in previous sessions, we've talked about harm is actually relative to the use, and then the use is relative to the satisfaction. So, if people are going from one product to another or using simultaneous products, is that any worse than actually, using one product that's actually giving the satisfaction? I think that's been an issue in other sessions.
But to give you some view of the scope, I mean, the review found that the people using these products are exposed to around 50 to 90% less of the harmful and potentially harmful compounds. That's a big space to be in, which suggests that we are still very unaware in this area.
Okay. And it depends what you're measuring as well, because that research has, for good reasons, measured the obvious thing, harmful compounds. I suppose the concern of a lot of the regulators is, are we missing something? And there's a lot of history here around history of, say, when low tar was promoted very heavily, going back 20 years or so. Actually, the consensus then became, well, people don't smoke like machines, because we measure nicotine with standard cigarettes and standard machines. People don't smoke like machines, and smokers adjust to get the nicotine hit that they need, feel they want. So low tar just in the end felt like a bit of a dead end. Now, we don't want to make a similar misstep in terms of regulation here.
In Japan, where e-cigarette, I think I'm right, aren't I? E-cigarettes are not available.
Yeah,
where heat not burn products, we've seen a rapid penetration of those heated tobacco products in their population, which suggests great take up and great addiction to them, which, dare I say, may be the point.
Stephen.
Yeah, just one final point, which is that to achieve our public health aims, we need to be getting the appropriate information to smokers, particularly. And that information is about what the alternatives are, whether it's cessation services, e-cigarettes, heat not burn, patches, gums, etc. What are the barriers to using the one product that they currently use, which is a packet of cigarettes, the barriers to using that to promote those services, inserts into the packet promoting alternatives which potentially offer less harm?
It's legal, essentially.
It's illegal.
It's illegal to do so, and
under
under the legislation. And the reason for that is there's
legislation?
It's sorry, I'll have to come back to you on the precise legislation, but the history here is that, as you'll recall, that tobacco companies used to put all sorts of things into cigarette packs, pictures of footballers, cricketers, etc., and vouchers and coupons, and so that was all made illegal. So it's one of the other things we can look at when with the review that we've already talked quite a bit about.
Is your point that we should lift the advertising regulations on e-cigarettes?
What I'm saying is you've got the
certainly
opportunity.
The industry's view.
Yes, but you've got an opportunity to use the one product that you know that a smoker is using on a regular basis to communicate with them, as opposed to using social media, Facebook, posters. They've got
the old sticks.
The sticks.
I see
you've
what
got the
you're
packet
saying.
to say, phone this number. try this, because everything other than that is a reduced harm.
So with the phone, I think I'm right in saying with there's not a single UK phone number, for example, for help stop smoking, so that's an issue. We can't use inserts. And we do effectively use the pack to give various messages because of the graphic health warnings.
Absolutely.
And
people play top trumps with that.
But I know what you're saying. It's an interesting point. Let us.
Okay.
Let me take it.
I would encourage you to look at that. I mean, the idea of an inserted public health message encouraging people to think about vaping or other methods of stopping smoking is perfectly rational.
Yeah, and in a time of tight resource, it is a very, very targeted message, isn't it, to the person who will open that packet of sticks. Yeah. Thank you, Mr. Metcalfe. You should work in public health.
Was that a job?
Good. No.
Any final questions from any of you? No. Thank you very much, both of you. Really appreciate your evidence. That concludes our evidence.
Can we just say we welcome this inquiry very much? It has been very. When I heard that you were doing this, we were doing a Westminster debate at the time, and it's very welcome that you're doing it. We see you as a partner in it.
Good. Thank you very much indeed. Order.